I'm washing my hands. Hi, my name is Haley. I'm going to be your student nurse today from the University of Southern Mississippi. I'm just going to be doing a cardiovascular, respiratory, and just some other assessments on you. It's going to take about 7 to 9 minutes, so it shouldn't be too long. Can you please state your name and date of birth for me?
Ariel Lever, 2/24/98.
All right, looks good. Okay, so first thing, I'm just going to kind of adjust your bed. How are you doing today?
Great.
Okay, so just off first glance, the A&P diameter is normal. It doesn't appear to be any barrel chesting there, so that looks good. Don't appear to be any lesions. So next thing I'm gonna do is I'm just gonna go through your lung fields, and I'm gonna have you breathe in and breathe out as I move from place to place, anteriorly and posteriorly, okay? All right, so that sounds good. No wheezing or anything happening. So now if I can just have you sit up and turn around, thank you. All right, and just breathe in and breathe out for me. All right, so everything with your lungs sounds good, so you can just sit back for me. All right, so I'm gonna move on to your cardiovascular. So skin doesn't look too pale or too red, looks normal. It's warm to the touch. The pulses, I can't really see any venous distension, so that looks good. So next thing I'm gonna do is I'm gonna check your, just 3 of your peripheral pulses. So I'm gonna check your radial pulse. So you can just turn your wrist. Radial pulses are good. I'm gonna check your brachial pulse. All right, brachial pulse is good, not bounding. Now I'm just gonna take your shoes off. All right, I'm gonna check your posterior tubercular pulse. All right, and pulses are good there, so that means we have good flow. And now, next thing, I'm gonna go over your central pulses. That's gonna be your femoral, carotid, and your apical pulse, but I'm gonna assess your apical pulse for 1 minute, okay? All right, your apical pulse was 82 beats per minute, and your respirations were also 14 respirations, which is in the normal range, and it wasn't too deep or too shallow of breathing. So next thing I'm going to do is I'm going to listen to your sounds in your heart, just kind of going from one place to another, checking for murmurs and stuff, and then we're just going to like reposition you to check for a few things, okay? All right, that sounds good. Now, can I have you just kind of sit up and lean forward for me? And I'm going to check for any aortic murmurs. All right, no aortic murmurs are present. So now I'm just going to reposition the bed into a lying position, and I'm going to have you lie on your left side, okay? Sorry about the noise. It's a little loud. Okay. I can have you lie on your left side for me. Alright, the T3 and T4 sounds weren't present, so your heart sounds good, your pulses are good, and the skin color is good. So now you can just kind of lie down again for me. Alright. And I'm just going to kind of go through some range of motion exercises with you. So can I have you just lift your leg up for me? Good. Can I have you bend your knee? Okay. Can I have you do the same thing with the other leg? Sit you up. And we're going to do some with your neck as well, okay? Just making sure that all your joints are moving good and all that kind of stuff. And have you had any trouble just getting up to go to the bathroom, fixing food, eating, or anything like that? Okay, so no trouble with your activities of daily living. Have you had any joint pain lately or swelling or anything like that? Okay. I'm also going to feel for that as I'm just going through your range of motion. So next thing, can I have you touch your chin to your chest for me? And can I have you lean your head back? All right. And can I have you raise your arms up for me, just out, and just kind of bend your elbows in? Any of that hurt? Nope. Okay. Can I have you just kind of like go in circles? All right, looks good. And can I have you flex your feet up towards you and down? Okay, that looks good. And I'm gonna move over this for a second. I'm just gonna have you get up, and I'm gonna have you walk to the door and walk back so I can check for your gait and your posture, okay? Gotcha. All right, you can stand up. Alright, off first glance, gait is good, doesn't need any assistive devices or anything to help her out, and you can sit back down. Alright, and then I'm just going to feel for any like swelling or anything in your knee. Alright, no swelling or anything happening there. Alright. I'm also just going to feel for like tenderness up in your chest and in your lung field, so if any of that hurts, just let me know. Does that hurt? Okay, no tenderness there. Alright, and next I'm just going to kind of move down into your like gastrointestinal, so this is about like your bowel habits and kind of stuff like that, okay? So When was your last bowel movement?
Yesterday.
Okay, can you describe the color and consistency for me?
Golden brown and formed.
Okay, and is that normal for you?
Yes.
Okay, looks good. So, bowel movements and stuff are just normal. Okay. And next thing I'm gonna do is I'm just gonna kind of go from one place to the other in your quadrants of your abdomen. I'm gonna listen for your bowel sounds, okay? And I'm gonna lay you down for this. And as I move from each quadrant, I'll just kind of tell you like some of the organs that are interested, so you kind of know what I'm listening to and just stuff about it. Alright, we're good. Alright, so I'm just gonna lift your shirt up a little bit so I can kind of get to it. Alright. Color of the abdomen is good. There don't seem to be any like distension there, so everything looks good. So now I'm just gonna listen. Now I'm gonna start in your right lower quadrant. And your right lower quadrant is going to have some parts of your colon in it, your intestine, and just some different things. It's also gonna have your appendix. So if you have any pain there, it's a sign of appendicitis. Then I'm gonna move to your right upper quadrant, which is gonna have your right kidney, some parts of your colon as well, and it's also gonna have your gallbladder. Then I'm gonna move to your left upper quadrant, which is going to have your stomach and spleen and your left kidney. And I'm gonna move down into your left lower quadrant, which is gonna have parts of your small intestine and your colon there, okay? Alright, everything sounds good there. Not hyper or hypoactive, so everything seems to be digesting correctly and moving right. So now I'm just gonna kind of just feel for some tenderness and some masses. So if anything does hurt when I press on it, just let me know, okay?
Gotcha.
Alright, there don't appear to be any masses, no tenderness there, so everything looks good with that. So I'm gonna sit you back up now. So overall, everything is good with cardiovascular, respiratory, your lungs sound good, no abnormal sounds there, no tenderness. You have good range of motion and you don't need any assisted devices, so that's a really good sign. And your gastrointestinal system, it's all, it's moving really good and digesting right, and your bowel habits seem to be normal. And then as far as like your peripheral vascular, your pulses are good, they're not bounding or anything, so overall the findings are good, there's no abnormal findings, so your physician will be in with you in just a second to go over a few more things. Did you have any questions for me?
I didn't.
All right, have a good day.
Thank you.